So I'm at day 5 of 7 on my inpatient rotation, and today's a little bit different because we actually got weather warning that it may snow a lot. So it's going to be interesting how it looks like in the afternoon and whether I'm able to make it back home safely. So to prepare for it, I packed clothes for about 3 days just in case we get snowed in. And if it snows, but if it's not as bad, I'll try my best to make it home, but I'm not going to go crazy if the snow is really bad. I'll just stay and see how it is. Hopefully it doesn't get snowed in, but we'll see. This is day 5 of mine. 5, 6, 7. Yeah, day 5. So it's interesting. I got switched to a different team. So learning a whole new service, but this is the teaching team. So I'll be working with a fellow and I think 2 residents. So different that have a completely new team, but good that I have a little bit more help. So right now we have 13 on our list. Of that 13, 4 of them are brand new, so I'm gonna go and see those 4 first. So I think the snow is coming down pretty hard right now. I'm hoping that it gets a little bit better or doesn't stick as much unless we all gonna be stuck here. I'm here till around 4 so I can make my decisions as to whether it is safe to drive at that time. Right now it's okay to drive, but if the snow sticks like I anticipate it's not going to be the best. No, that's my biggest fear. If you can see, some of the roads up there haven't been iced appropriately and will lead to a lot of incidents that I don't want to have. So hopefully the roads stay like that, well, the clear part, but we'll see in about 6 hours. But right now I'm finished seeing the patients from overnight and the rounding ones. There's 2 new patients that I have to see that we just got a few minutes ago. So one of the things I'm going to do is finish notes and then go see those brand new ones. We have residents, but I want them to go home pretty soon, within the next 3 hours to avoid the inclement weather. So I'm going to finish these notes and then go see the patient, and then it's time to pray that we don't get any more consults, and then I can be gone in about 5 to 6 hours. He's doing well post AVR period. Systolic blood pressures has been maintaining in the 120s period. Next line, we'll continue to monitor him in the ICU period. Next line, anticipate that he will likely get his tubes pulled out soon period. Next line, we will continue to monitor the patient and make further recommendations as clinically indicated period. All right, so all the notes have been done, except for one. I'm still waiting for that one note, but all the patients have been seen from overnight, and the ones to round on. We have 4 new patients that we've just seen. Most of them are due to rhythm, so I'm gonna go and see those ones and then try to get my residents out within the next 1 hour. Just a little bit of an update. It looks I wanted to say it looks unchanged. If anything, the snowing looks like it's tapered off just a little bit compared to how it was. It's still going, but not as fast as it was. So hopefully this maintains like this for the next 5 hours, and then I can make it home safely. It's not looking promising anymore. I keep looking, hoping that I'll get just something that shows that the snowing has gotten better. But it looks like it's actually getting worse. And that's it for me, guys. I have finished seeing all the patients. There's one more note that I have to write that I'm waiting for it to come in, but I'm done seeing the patients. The roads don't look as bad. I'm hopeful. If that's the side roads, the main road should look good, so I'm excited about that. Leave my stethoscope because tomorrow is a 24-hour call, so let's get it. Definitely, there's a lot of snow. Wish me luck. Not gonna need any luck. It's gonna go well, but it definitely is a lot of snow. But I'm close to home, but I had to make a pit stop because I was going to run out of gas. I wasn't gonna have enough gas for tomorrow. Thankfully, I looked down because this drive was not what I expected. The roads that I expected to be really nice ended up not being as nice as I wanted it to be. And the roads that I expected to be a little bit more of a challenge actually was nice. So what I think happened is, of course, the roads that are closest to my neighborhood last year were treacherous. So I think we remembered that, and the North remembers. We remembered that, and then have been treating these roads with care, anticipating this ice versus the bigger roads. It's just big roads, and not that it wasn't kept how I expected. It was more that there was a lot more black ice, and the black ice can be slippery, and did have one time when I skid for maybe a half a second, but enough to pick my heart rate up and cause my anal tone to probably shouldn't have said that. But yeah, it was scary, but got gas for tomorrow and Sunday, and I'm about 4 minutes from home, so I just wanted to make sure that I had enough gas. Thankfully, we got food yesterday, and we're stocked up for the next few days. Look how crazy it looks, though. I mean, this is close to one of the grocery stores that we go to, Ingles, and it's just snow everywhere. It looks nice, but not the nice that I want. All right, y'all, just got home, and I just wanted to go over some of the pretty cool cases that we saw. Most of them, it's cool to me, but it is pretty redundant. There was one who had a basically heart failure, but more interestingly, they have a Watchman device. Now, a Watchman device is what we use for people who have atrial fibrillation, but they want to be off blood thinners and they have enough risk factors and a bleeding history. So you have to look at the risk and the benefits of bleeding versus being on blood thinners. And it was too risky to put him on blood thinners, so the Watchman device puts a cap over a specific area of the heart known as the left atrial appendage, where clots can form, which can cause blood clots in the future, can cause strokes in the future. So we put a cap over it. It's a pretty invasive procedure, but the reason that they wanted us to see this individual is because there may be a leak around their Watchman device. So on Monday, we're gonna look to see if that leak is real. If it is, then they need to follow up with their cardiologist who put that Watchman device in to see what can be done. Unfortunately, it may actually mean being put back on blood thinners. A second one was for someone who's having sinus pauses, meaning their heart's beating, and then there's a pause. This pause was actually for a long period of time. When we see things like that, we want to make sure they don't have sleep apnea. If they do, they're being treated for it. And number two, they're reversible causes. This individual had high potassium levels. They have sleep apnea, which is not being treated. And they are on multiple medications which can cause abnormal EKGs. So we recommended for them to get the sleep apnea and the medications for them to look at to see if those can be stopped or changed to a different medication. Another one had heart failure with atrial fibrillation, so you're treating both of them. We think that the heart failure made the atrial fibrillation worse, so our goal is to try to treat the heart failure in hopes that they convert back to normal rhythm. If they don't convert back to normal rhythm, then we're going to look at possibly doing a cardioversion to get them back to normal rhythm, and then for them to follow up with their primary cardiologist outpatient to see if they even need an ablation, which can potentially be curative for them. Another one had an abnormal echocardiogram, but we did a heart catheterization and everything looked normal, and we think their echo was abnormal due to stress-induced cardiomyopathy, broken heart syndrome, which is another term for it. So we're going to actually repeat the echo to see if it's improved over time. Other ones were just people who've had heart disease that led to them having open heart surgery. So a lot of times when someone has had the heart surgery, the surgeons want them to follow up with cardiology after the surgery to make sure that medications are appropriate, kidney numbers are appropriate. We had one that
developed atrial fibrillation, so we're treating that for the next 48 hours to see if it can flip back into normal rhythm. But the rest of them are doing well, so we're just following up with them on a routinely basis and seeing how they're doing. They'll start cardiac rehab while in the hospital and then have that extended to the outpatient setting. Overall, pretty good day. Roads were dangerous. I'm glad I was able to get back home safely, and then tomorrow's a 24-hour shift. I'll see you guys then for day 6 out of 7. Peace.